Hey everybody, it's Wednesday, time for Wisdom Wednesday. Thought I would do a little quick video on hypertension. I've had a few patients coming in fairly recently with just some persistent borderline elevated blood pressures and some higher blood pressures, and thought I would just talk a little bit about ways that maybe we could approach this particular issue and treat it non-pharmaceutically for as long as possible. However, pharmaceuticals are quite good at managing blood pressure, but perhaps there are things that we can do before you have to start taking a medication for blood pressure. So what is high blood pressure? Well, when you have your blood pressure taken, the cuff that is applied is measuring the pressure when your heart beats, and that's the systolic pressure. And then in between the beat, at its lowest pressure as the heart is filling, the lower number is called diastolic blood pressure, and that's prior to the heartbeat at its most restful phase as it's filling. And generally speaking, we want that blood pressure to be less than 120/80. And that anything above that is beginning to be what we call borderline, and then anything above, by definition, 140/90 is considered outright hypertension or high blood pressure. So a lot of us are sort of in that in-between stage between 120/80 and 140/90. And certainly we have a lot of folks who come in that have quote unquote white coat hypertension, meaning just coming to the doctor makes you somewhat anxious, gets your adrenaline going, which can cause some constriction of blood vessels and increase blood pressure. And so it's important to check some numbers when you're not in a situation where you might be a little stressed out. So getting a blood pressure cuff, even just an automatic cuff from Amazon, $35, $40 cuff, is a reasonable thing to do, particularly if you've ever had a family history, or if when you go to the doctor, you tend to have some borderline blood pressures. Because this is a really common problem. 75 million people in the United States have hypertension. That's 1 in 3 adults, basically, and that's the people who are diagnosed. A lot of folks probably have this who are not diagnosed. And so it's really a very common problem, but does have a lot of impact on health over time in terms of organ health and brain and heart health, obviously, which we're all very familiar with. But nonetheless, it's important to address it and to pick it up as early as possible and begin to manage it. Now, what are the things that we can do before we have to go on medication? Well, we know that weight loss is very beneficial to managing blood pressure. It's thought that for every kilogram or 2.2 pounds, so to speak, of weight loss lowers that diastolic and systolic pressure by 1 millimeter of mercury. So weight loss can have some good impact, as well as exercise. Exercise, very beneficial for blood pressure. We also know that from a nutritional standpoint, that eating a lot of processed foods, drinking a lot of alcohol, a lot of trans fats, a lot of sugars, anybody with insulin resistance is just going to be at greater risk for blood pressure problems. So recognizing what you're doing dietary-wise can make a huge difference in terms of lowering blood pressure as well. So getting on a whole foods diet and certainly when you look at Mediterranean diet, etc. Now, in the past, we've talked a lot about low sodium diets, and there may be some aspect for some people, getting on a low sodium diet may make a difference. But if you really are well hydrated and have very active kidneys, you probably can tolerate a modicum of sodium or salt in your diet and don't have to go on just an absolutely no salt diet. That's pretty rare to see that that's an absolute necessity. But nonetheless, it certainly is something that you can avoid eating a ton of salt. But if you do have something salty, you should drink more water, and that should help with the aspect of that osmotic effect that can cause some constriction of the blood vessels or sensing of pressure on the blood vessels. So weight loss beneficial and exercise beneficial, nutrition-wise obviously very beneficial. And then there are a few things that you can take. Magnesium can be very helpful for lowering blood pressure. It's a calming type of mineral. Omega-3 fatty acids can also be beneficial to the vasculature, as well as coenzyme Q10. There's also, I get a lot of folks started on an herbal product called Carditone, and for many people that helps to just lower it enough while you're trying to work on some of these other things so that you don't have to go on medication. However, if your blood pressure remains high, I think it's important to get that managed and treated. Now, if you're monitoring your blood pressure at home, don't become just tied to it. I recommend you check a blood pressure 2 or 3 times a week, maybe on a morning, a midday, an afternoon, or in the evening. Blood pressure tends to be a little higher in the morning because you've had this cortisol sort of elevation to get you up and going in the morning, and it tends to peak around 8 o'clock in the morning. So blood pressure can be a little bit higher at that point. It's important when you do take your blood pressure to just sit down and be still for a couple of minutes and let everything just equilibrate, and then check your blood pressure, write it down, and keep a journal. And it's important then to report that to your care provider so that you can establish some type of protocol and way of trying to get this managed as you move forward. Just because you have a family history doesn't mean you'll get it, but it is, as you can tell, 1 in 3 adults have blood pressure issues, that this is very common. And getting it treated and getting it managed is one of the best things you can do for your overall health and wellness in the long term, in terms of just what it can do for organ damage, what it can do as far as increasing risk for cardiovascular and cerebrovascular disease. Hopefully that's been of some benefit to you. If you are concerned about your blood pressure, please make sure that you talk to your physician, talk to us, and let us know. I would not do any long-term herbal treatment, say with Carditone long-term, without discussing it with your provider. But I just wanted to let you know that there are a few things out there that you can do in addition to doing the magnesium and the fish oil and the CoQ10, which can be helpful as well as you try to get to a healthier weight, as you try to work on your nutrition and lower insulin resistance, and as you begin to work out. You all have a great week, and we'll talk again next week.